Let me tell you something that many people never hear clearly. In 2026, there are several programs that can help many older Americans reduce everyday expenses or increase the financial assistance they're already eligible to receive. Yet a surprising number of people never apply. Not necessarily because they don't qualify, but because they simply don't know these programs exist or assume they're not eligible. After months of hearing about rising prices, higher living costs, and financial uncertainty, I'd like to focus on something more encouraging: legitimate programs that may help put money back in your pocket. Today we'll look at 3 important programs. One may help pay your Medicare Part B premium. Another can help lower home heating and cooling costs. And the third could provide an additional monthly benefit for people who qualify but haven't applied. Research has shown that many eligible older adults never claim benefits they're entitled to receive. That's why understanding what's available can make a real difference. Stay with me, because I'll explain each program in plain English: what it is, who may qualify, common misconceptions about income limits, and how to apply. I'll also point out a few scams to watch for, because whenever legitimate benefits exist, scammers often try to take advantage of them. One of the biggest mistakes people make is assuming they earn too much without ever checking the actual eligibility rules. Every program has its own requirements, and in many cases the limits are higher than people expect. Rather than ruling yourself out, it's always worth checking with the official agency that administers the program. My name is Walter Barron. For more than 15 years, I've worked as an estate attorney, helping families understand government programs, estate planning, and the financial rules that affect retirement. My goal is simply to explain these programs in straightforward language so you can make informed decisions. I'm not selling anything, and I don't receive any compensation based on whether you apply for a benefit. Whether you're recently retired or well into your retirement years, I encourage you to watch all the way through before deciding that a program isn't right for you. A question I hear all the time is, if these programs are real, why haven't I heard about them? It's a fair question. The reality is that most assistance programs require people to apply. Government agencies generally don't contact individuals to tell them every benefit they might qualify for. Instead, the programs remain available until someone learns about them and submits an application. Many of these programs also have complicated names and different eligibility rules from state to state, which can make them easy to overlook. Let's start with the first program: Medicare Savings Programs. If you're enrolled in Medicare Part B, you pay a monthly premium that is often deducted directly from your Social Security benefit before you receive your payment. For some people with limited income and resources, Medicare Savings Programs (MSPs) may help pay some or all of that Part B premium. Depending on the specific program and your eligibility, some MSPs may also help cover certain Medicare deductibles, coinsurance, or copayments. Because these programs are administered through state Medicaid agencies, eligibility rules, including income and asset limits, vary by state and may change each year. The important takeaway is this: don't assume you don't qualify simply because your income seems too high. Many people are surprised to learn they may be eligible after completing an official application. Imagine someone like Margaret, a 73-year-old widow living primarily on Social Security. She always assumed assistance programs were meant for someone with a much lower income than hers. When she finally checked her eligibility through her state's Medicaid office, she learned she qualified for a Medicare Savings Program. As a result, her Part B premium was covered, allowing her to keep more of her monthly Social Security benefit. Stories like this illustrate why it's worth checking, even if you're unsure. How to apply? You can apply through your state's Medicaid office. Another excellent resource is your local state health insurance assistance program, LIHEAP, which provides free, unbiased counseling to Medicare beneficiaries. When you call, you don't need to know every detail of the program. Simply say, "I'm enrolled in Medicare and would like to find out whether I qualify for a Medicare Savings Program." The counselor can explain the requirements, answer your questions, and guide you through the application process. Scam warning: unfortunately, scammers often target older adults by pretending to represent Medicare or Social Security. Be cautious if someone calls unexpectedly claiming they can activate benefits or refund your Medicare premiums, but first needs your bank account information, Medicare number, or Social Security number. Official agencies generally do not make unsolicited calls asking for sensitive financial information to issue benefits. If you're unsure, hang up and contact your state's Medicaid office or your local SHIP program directly using publicly listed contact information. Now let's move to the second program, which may help with one of the biggest household expenses many retirees face: utility bills. 2. Low-Income Home Energy Assistance Program, commonly known as LIHEP. The Low-Income Home Energy Assistance Program, commonly known as LIHEP, is a federally funded program administered by states that helps eligible households pay heating and cooling costs. Depending on where you live, your household size, income, and available funding, assistance may range from a modest payment to a larger benefit paid directly to your utility provider. Many people think LIHEP only provides winter heating assistance, but in many states it can also help with summer cooling costs, an important resource during periods of extreme heat. Some states also offer emergency assistance for households facing utility shutoff notices or experiencing heating or cooling equipment failures. Receiving LIHEAP benefits generally does not reduce your Social Security benefits, although eligibility rules and program details vary by state. If you think you might qualify, it's worth contacting your state's LIHEAP office to learn about current eligibility requirements and application deadlines. One important thing to remember is that these programs have limited funding and specific eligibility rules. That's why it's worth checking sooner rather than later, instead of assuming you'll always have time. For example, the Low-Income Home Energy Assistance Program, LIHEP, is funded each year, and many states distribute assistance until available funds are exhausted. Application periods, benefit amounts, and eligibility requirements vary by state, so applying early can increase your chances of receiving help if you qualify. Many states also prioritize households considered most vulnerable, including older adults living on fixed incomes. That doesn't guarantee approval, but it does mean it's worth finding out whether you're eligible instead of assuming you're not. Imagine a retired couple living on Social Security and a modest pension. Every winter they watch their heating bills climb and try to keep costs down by using less heat than they really needed. They had never applied for an assistance program before because they assumed it wasn't meant for people like them. After speaking with their local energy assistance office, they learned they qualified for help. Part of their seasonal heating costs was covered, and they were also directed to resources that helped address problems with their aging heating system. The assistance didn't solve every financial challenge, but it made a meaningful difference. Sometimes the hardest part is simply making the first phone call. How to apply? Every state administers LIHEAP through a designated agency. You can contact your state's energy assistance office directly, or in many areas simply dial 211, a free community information service that can connect you with local resources and explain where to apply. Applications are free. No legitimate agency should charge you a fee simply to submit an application for LIHEAP. Program #3, Supplemental Security Income, SSI. The third program may be the most valuable for people who qualify because it provides an ongoing monthly cash benefit rather than paying a specific bill. It's called Supplemental Security Income, or SSI. This is where many people get confused. Social Security retirement benefits and SSI are two separate federal programs with different eligibility rules. Social Security retirement benefits are based primarily on your work history and the payroll taxes you paid during your career. SSI is a needs-based program designed for people who are age 65 or older, blind or disabled, who have limited income and limited resources. One common misconception is that receiving Social Security retirement benefits automatically makes someone ineligible for SSI. That's not necessarily true. Some people receive both benefits at the same time, although the amount of SSI they receive depends on their income, resources, and other eligibility factors. Each year, SSI payment amounts and financial eligibility thresholds may be adjusted, including through annual cost of living changes. If your circumstances meet the program requirements, you could receive a monthly SSI payment in addition to your Social Security retirement benefit. If you already receive Social Security, your SSI payment may be reduced depending on your income, but a reduced benefit may still provide meaningful monthly assistance. Another point that often surprises people is how resources are counted. In many cases, the home you live in is not counted as a resource for SSI eligibility. One vehicle used for transportation is also commonly excluded under SSI rules. Other financial resources are considered, so eligibility depends on your complete financial situation. That's why it's important not to assume you're ineligible simply because you own your home or have modest savings. Consider someone like Tom. After decades of work, he retired with a relatively small Social Security benefit. As living expenses increased, his monthly budget became tighter every year. Tom assumed SSI wasn't an option because he already received Social Security. When he finally contacted the Social Security Administration and completed an eligibility review, he learned he qualified for a partial SSI payment. That additional monthly income helped make his budget more manageable. Every situation is different, but Tom's story illustrates why checking eligibility can be worthwhile. How to apply? You can apply for SSI directly through the Social Security Administration online, by phone, or by scheduling an appointment at your local Social Security office. Applying is free, and you never need to pay someone simply to submit an SSI application on your behalf. Why it's worth checking again, even if you looked into one of these programs in the past and didn't qualify, it's still worth checking again. Many federal benefit programs are updated periodically. Income thresholds, benefit amounts, Medicare premiums, and other eligibility standards can change from year to year. That means someone who didn't qualify previously could qualify after updated limits take effect or because their own financial circumstances have changed. Rather than relying on an old decision, consider requesting a new eligibility review if it's been a while since you last applied, bringing it all together. Depending on your individual circumstances, these programs may help with different parts of your monthly budget. A Medicare Savings Program may help pay your Medicare Part B premium and, in some cases, other Medicare cost-sharing expenses. LIHEAP may help reduce eligible home heating or cooling costs. SSI may provide an additional monthly payment for people who meet the program's financial and eligibility requirements. Not everyone will qualify for all three programs, and some people may not qualify for any of them. But many eligible older adults never apply simply because they assume they won't qualify. The only reliable way to know is to check through the official application process. Imagine someone living on a modest fixed income who qualifies for more than one of these programs. Lower Medicare costs, assistance with utility bills, and an additional monthly SSI payment could make a significant difference in managing everyday expenses. Every person's situation is unique, but for those who qualify, these programs can provide valuable financial support. If you'd like to learn more, I've also created a guide called the Senior Money Playbook that brings together many of the programs, tax considerations, and benefit strategies I discuss on this channel in one easy-to-follow resource. You'll find more information in the video description if you're interested. Most importantly, don't let assumptions keep you from checking. Take these one at a time. For Medicare Savings Programs, contact your State Health Insurance Assistance Program SHIP or your state's Medicaid office. For LIHEAP, call 211 or reach out to your state's Energy Assistance Office. For SSI, contact the Social Security Administration directly. All of these application processes are free. And remember one final safety reminder. If someone unexpectedly calls claiming they can unlock your benefits or asks for your bank account, Medicare number, or Social Security number over the phone, be cautious. Official government agencies generally do not make unsolicited calls requesting sensitive financial information in order to issue benefits. If you're ever unsure, hang up and contact the agency directly using its official phone number or website. The most important takeaway is simple. Don't assume you aren't eligible. Check. A few minutes spent verifying your eligibility could help you discover benefits you may qualify for. If you found this information helpful, consider sharing this video with a friend or family member who might benefit from it. And if you'd like more straightforward explanations of retirement benefits, Medicare, Social Security, and programs for older adults, consider subscribing and turning on notifications so you don't miss future updates.